The Philippine Nurses Association of Nevada now brings you FilipiNARS, news and features about the Filipino-American nursing community and beyond. And now, here's your host, Doris Bauer.
Well, hello to all of you FilipiNARS followers. Thank you so much for joining us today. I hope that you are all doing well. And as you know, FilipiNARS is brought to you as a public service project of the Philippine Nurses Association of Nevada in collaboration with PHLV Radio. So this program is disseminated in different social media platforms like Facebook, YouTube, iHeart, and Amazon Fire TV. And this is also shared in our association's website at pnanv.org. So thank you for joining us. Well, today we are highlighting some very special nurses in the cardiovascular field. These days, it is expected that nurses and advanced nurse practitioners or advanced practice nurses are playing a lead role in identifying and implementing risk reduction strategies for different diseases. And this includes the cardiovascular diseases. So we have invited the board members of the Southern Nevada PCNA, or the Preventative Cardiovascular Nurses Association. So please welcome Kay Dentscheff and Florian Ricafort. Welcome, ladies.
Thank you.
Thank you.
Good. You excited to be here?
Yes, we are.
Good. Okay, since I would like for you guys to introduce yourself, I know that Credlin Dentscheff, actually, but she likes to be called Kay, is a BSN, RN, NPD-BC, and she is the chair of the Education Committee of PCNA. What can you add to that, Kay?
I actually graduated this year with my master's degree in education, so that was a great accomplishment this year. I think I've been a nurse for about 8 years, mainly oncology, but luckily, everything that I've worked in always had some part of telemetry involved. So cardiovascular, you can definitely see how it's the heart that controls everything, not just the brain. But it really is a great experience to be working here in Las Vegas and what I've had in the past 8 years for sure.
Very good, very good. And Ms. Florian Ricafort is a BSN RN, and she is the Membership and Events Coordinator for PCNA, right?
Yes, I am.
Okay, so tell us a little bit about yourself, Florian.
In my nursing career, I'm one of the baby nurses. I still consider myself. Every day we're growing and learning. So I started here actually at Sunrise. I'm still currently there. I've been enjoying being in the cardiac med surge now for 2 years, and I'm happy that that's where I have started, because like Kay said, it is every patient that you go into, it's a good foundation to have that cardiovascular exposure and expertise. So I recently transitioned into leadership too, and kind of seeing like a different realm there.
Very good.
So far so good, and being part of PCNA is definitely broadening my vision of what else I can do for my community, not just in the hospital.
That is awesome. Thank you, ladies. And yes, compared to me, y'all are babies. So can
I be the auntie?
You can call me auntie. Okay. So tell us about PCNA. That's the and what are your goals and your mission as an association?
So Preventative Cardiovascular Nurses Association is a big national organization. Our goal is, number one, to have an intercollaborative effort in our community, starting with Nevada first. As Southern Nevada District, there was no organization here for this organization. So having this chapter is the start of it for us. Good. We attended one of their big med-surg conferences in 2019, 2020, and we saw that it doesn't only involve people with master's degrees or any doctorate degree. They had a lot of there's some new grad nurses. I was a new grad at that time, and a lot of different nurses are in there. it might sound like jargon, but it was very inviting to share that, the profession is more than just in hospital education. It's more of applying it in our practice and also sharing it with our community. So that one really inspired us, and Kay actually is our educator at that time. So reeling her in and just seeing how do we do this, and that's what nursing is always about.
Correct.
Like trying to learn and trying to share. So we put everybody together, and now we're thinking about ways of how we can do it. May it be volunteering, continuing to doing education and events.
Good.
So that's what we want to do.
Yeah. I'm so glad that you did mention that, because there's not only the higher people that are nurse practitioners or doctorates. You have to also deal with the public and the nurses who are just getting started and not having more of the higher education, so to speak. So thank you for that. So how did you organize this chapter?
So it's funny because Florian, as she said, she was a baby nurse and I was her educator at the time. She came up to me and was like, I want to do this chapter. We learned about it at a conference and I want to start one here. And I said, okay, build me a PowerPoint and pitch me the idea. And it was my way of teaching her how to start something. Like, if you want something, how are you going to present it? And she got her manager involved, and then she kind of presented it and I was like, okay, sounds great. Let's start it. And she did it herself, and really I put a lot of kudos to her for building that or having that initiative to start it and to continue it now for 2 years and build the programs and reach out to her friends, her other nurses, and try to gain membership and have buy-in, and that's really how it started. And then we went to the PCNA conference in New Orleans, I think last April. It was the first one we did together as a chapter, and we learned a lot, and we also learned a lot of mistakes at our own spring event, and we just continue to grow and learn from that, and hopefully the next event will be better.
And that is really what it takes. You have to have a passion for what you are organizing. I did this back in the day. I'm an IB nurse, and
give me your tips.
Yeah, how come? Anyway, I just basically thought I was with an association called AVA at the time. It's called Association of Vascular Access, but now it has become worldwide. So they started different chapters as well, and there wasn't any network here in Nevada. So I said, let's start it. So it's called NAVAN, Nevada Vascular Access Network.
I've definitely used their material.
Yes, I was the first president, and so it was good. So now it's still thriving. So I applaud you guys.
Thank you.
Great. That's great. That's good. So how many chapters does the National Association have, and in what states are they in? Do you know?
They have more than 15 states. I believe that's why we were one of the lacking states that we've identified. They have more than 15 or 20 out there.
Wow, that's good.
One of their biggest and more successful organizations were the ones in New Orleans, the Crescent City chapter, and we are very inspired with them. They're so proactive, even with, I think, vaccine clinics. They're out there. They are always one of the big leaders that's presenting in the big conferences. So they are our role models. We want to be that kind of a proactive organization that contributes to this community, so that we can, not just kind of like gatekeep what we know, but we want to get more people to help us with being successful, so we can better affect the community.
And definitely on the West Coast, sometimes they like to say that healthcare is a little bit behind on the west side of the states, but this is our way to not gatekeep. We're breaking down silos. We want to open up that network and really have communication throughout the states.
Yeah,
very good. Yeah, and it takes charged people like you to get this done. So this is good. So who can join your association?
Anyone, any nurses.
Any nurses, even with our events, we're offering free CEs. But if anybody's interested, even if as a student, you're interested in kind of like getting out there and starting to learn, like, what department do I want to belong in? We are welcoming them. Yeah. Because we're not limiting also our speakers to just cardiovascular. It's not just doctors, it's not just APRNs, it's basically everybody. We can invite you as long as you're expert in the subject, and whoever is interested in learning that, you're welcome to come.
Yep, and membership, it's you just apply online. And
apply online.
Just apply online.
And you have a website, right? It is?
It's it's the PCNA.net website. You have to look for the Southern Nevada chapter.
Okay, very good, very good. So the National PCNA's website says that nurses are leading the way in preventing cardiovascular disease. So do you also see that here in our community? Like a lot of people, having cardiovascular disease, and can you give us any examples?
Well, and in my opinion, I think we are lacking with our promotion, with our education. Being a bedside nurse, we realized that we have a lot of frequent flyers coming back. So we always talk about there are government, government benefits or centers where they can go to. But what's lacking is the retention of this education. We're seeing that at discharge, we're educating the patients. But how much of that is being reinforced? How much of that are they capable of paying for these things? So I think that in PCNA, we haven't identified any very effective movements that we've been having there. But I really think that even we share a lot of cardiac rehab is the number one thing we're encouraging. But again, you're seeing a lot of barriers and challenges for our patients and our community when it's about the financial ability of patients, how far are they from
and
facilities.
Location, because I think cardiac rehab alone, I think maybe in the city we may have one in Las Vegas.
I think you're right about that. I think we had that guy in our program a couple of years back, and I haven't had any updates on anything. So
I think we have one in the city, and they don't accept a lot of patients, and the next closest one I think is in Arizona. And so cardiac rehab has been shown to really help preventative measures because they're continuing the exercise, the diet planning, the nutrition, and they have a full comprehensive understanding of what they need to do to get their cardiac health in line with the goals. But we just don't have those resources here. And, life gets busy. And we talk about cardiovascular health all the time. We see the commercials for it all the time.
Xarelto is always out there.
There's you to get healthy, all these fad diets. But it's really hard to kind of focus and hone in to every individual when life just gets too busy.
Life does get busy. And you are correct about that. There's a lot of associations that are being crafted out there or organized. But, they are associated with a reporting mechanism to somebody else higher than them. But then, so the whole local scene is sort of kind of missed, you know?
I think we love that. We love that there's a lot of organizations that is trying to help this. So Preventative Cardiovascular, part of our mission is really bringing everybody together, being on the same page. We are starting small, but our goal is not just Las Vegas. We want to start reaching out when we can and get more participation to Henderson. We want to get to Boulder. We want to kind of spread out through the whole of Nevada and really cater to everybody there.
And I think we kind of touched on it, understanding the health literacy of individuals, of our community, of our clientele. It's important because we see all these things, we have all these resources, but no one understands the basis of where this research is going. So I think we can help bridge that gap in really providing our community with the understanding of this is why your physicians are telling you to do this. This is why the nurses are acting this way and they're telling you to exercise more. Let me help you understand that, because not everyone has that understanding.
That's correct.
And I think it's really a great opportunity for us to bridge that within our community.
And I love that, bridging the gap between what is actually out there and what people know, and how are they going to get there? How are they going to make it happen to benefit from the information that they have, and specifically for cardiovascular. And I know you probably don't have statistics, but in the Filipino American community, cardiovascular disease is pretty high up there.
Listen, it's all the adobo.
It's the lechon.
It's the lechon. Oh, chicharon. It's all those
there
things.
You go. So, I'm so glad that you are going to actually try to do this. I'm sure you're going to be collaborating with a lot of people. And hey, whatever we can do from a PNANV standpoint, let us know.
It's huge. I think it's important because especially in the Filipino community, I feel like we always say growing up in my family, like, I know I'm going to have high blood pressure the moment I hit 50. Like,
Me too,
I know.
actually, I'm expecting it.
I know I'm going to have, like, high cholesterol, too. It's just a matter of time. But, like, I also know that I can prevent it. Like, this is why I was like, oh, PCNA
But
makes
I
sense.
want my adobo today.
I want my adobo.
Yes.
But I also know that just means I have to exercise more if I'm going to eat.
That's correct. That's correct. So how will your chapter, PCNA Southern Nevada, how do you plan on disseminating this information to educate the public?
So we have, twice a year, we have events. Where we invite student nurses, anyone in the community to come, nurses, they get CEs, physicians if they want, to come to this event, and we provide just speakers that just present topics, and you learn, and it's our opportunity to get to know us. We open anyone to come and ask us questions. We can network if you'd like. We've started to reach out to community, like physicians and private clinics, to kind of just open that door with us, like to have that communication with us so far. We really would hope that we can get more understanding of what we do. Like, I think from my understanding, PCNA might be changing their name because it does confuse some.
Yeah, it is a little bit confusing. A CNA is usually it looks like a certified nursing assistant, and I honestly had to look it up.
Yeah.
I said, okay, what is the actual name of PCNA?
So I think they're in the middle of trying to determine like how we can change that as a whole organization to help the community understand what we actually do, like our goals and our missions, and really bridge that understanding of we want to prevent what can be preventable. So
absolutely. So you mentioned something about events such as educational events. You have an event coming up in October 7th, and it is called what is it called?
The
It's a fall chapter.
It's a fall
event.
chapter.
Yes.
Okay. Can you talk about that a little bit?
Yes. So
I think we have a flyer that we can put on screen. So
on Saturday, October 7th, we're going to be having two amazing speakers. One is going to be Miss Tycee Harris. She is very well versed in the cardiovascular field. She's one of the APRN that mainly handled our cardiac cases and assisted our primary cardiovascular doctor in the hospital.
Okay.
So she's going to be sharing something about AFib. And so that's going to be awesome. It's something new. We have all these, again, commercials about medications. She can help kind of, even in the community, if you're not a nurse, you want to come and learn about AFib. This is a good way, and you can ask her questions and she can answer it.
And then Dr. Edward Hoffler is going to be doing the first presentation. He's going to be talking about exercise. And obesity, and how that correlates in cardiovascular health. So he's an amazing physician. He's very knowledgeable and very transparent and willing to work with the nurses, which we appreciate. We love.
That's awesome.
But it is going to be at Sunrise Hospital in the auditorium, October 7th. Registration starts at 9, and the first speaker is slated to start at 10. And you can register online or you can register in person.
Okay, so it's going to be at Sunrise Hospital then.
Correct.
Okay, that's good. This is interesting. Very, very interesting. I have someone dear to me who has AFib, so it's like, how do we do this? How are you controlling it? We went to what was that procedure that they burned the it's
ablation.
Thank you very much.
Yes.
Yeah, it only worked for 10 days, and he was back on it. So I'm like, oh, okay. So this is gonna be this is interesting. So
it's a good avenue to ask questions. That's why we are opening it to public. If you just want to come, you won't get the CEs. It's not gonna be
of course, yeah.
But lunch is served.
Yes.
Oh, there you go. I'm
important.
there. That's good. So the PCNA fall event is on October 7th, and it is going to be at Sunrise Hospital. And this is good. This is open to the public as well. Very good. Very good. Okay. And you can go to your website to register, or
And on our flyer, there's also, you can see the website on the flyer.
Okay.
And there's a QR code. Our Instagram handle is there. There's videos we'll show you how to register, because it does get a little confusing on how to register from the PCNA website, because it makes it look like you want to buy something, but it's free. We promise. It's free.
That's good. That's good. So we'll see what we can do. We can definitely disseminate this information. Okay. Yes. And I know that your president is not here. She did say, hey, I'm going to be coming, but I would like to let everyone know. I guess she's in a wedding somewhere. Hi, Giselle.
Hi, Giselle. I hope you're having fun in Texas.
Okay, so I also want to let the public know and let our listeners know that the president of Southern Nevada PCNA, Giselle Corpus, was awarded the Nurse Executive of the Year Award for the FONN, which is the Future of Nurses in Nevada Awards, just recently. So, Giselle, we applaud you. Bravo. Congratulations. I wish you were here to tell us about that award, but
she's very excited about it. She did not expect to be nominated, but I know that part of it was what PCNA was, and her part of it, and how we all grouped together, and she did it.
And you were nominated too.
I was nominated for Educator Award.
Come on, Kay.
I was on vacation when someone told me I was nominated, and I didn't know what I thought it was a scam.
No, it is not. I've been part of the FONA and the NAC for a very long time, and we had to pause a little bit for the pandemic.
Of course.
So, yeah, but it's...
But I read through what FONN is doing, and it sounds amazing. There's so many individuals in there that are involved.
Right.
I think it's a great organization.
Yeah, it's a good recognition for the nurses and what they do, so that's good. Anyway, so what else can you say about PCNA?
I think it's fun. Honestly, we started PCNA because it was an opportunity that we saw to help our community, but we also just it was a group of friends that just wanted to do something fun. And we've enjoyed it, and we continue to enjoy it, and we hope that we can get other people to just join in.
Yeah, and you said that there is volunteer opportunities.
Yes, we do volunteer opportunities. We need some help with maybe setting up our events. So that's one way of anybody who wants to collaborate with us and kind of see what we're about. Not sure if you want to join. That's going to be a good way to kind of learn about the organization, especially specifically the Southern Nevada chapter.
And I think as a group in PCNA, we, outside of the actual event on October 7th, we are also participating and volunteering at the American Heart Association Heart Walk. And we are also going to help locally at Opportunity Village, and we're going to actually help chaperone and set up and break down their dance that they're having for their team.
Oh, that's good. Yeah. That's good. So apart from AFib, what other types of, what do you call this, diagnosis or teaching are you going to do? What instances?
Our last event, we highlighted hypertension and diabetes.
And diabetes and cardiovascular risk.
Yes.
And that was actually a very interesting topic because of the new fad, the semaglutide weight loss drug.
Right.
And that they got into a great dialogue during the event, asking about the side effects of that drug. How does that affect cardiovascular risk? How is it going to affect like your stomach and GI issues? So it was a really interesting dialogue because we had a like pharmacist in the room. We've had nurses who aren't currently practicing,
like a dietitian was in there.
Yeah, so it was a great dialogue to actually learn about this new drug that was being promoted.
Man, I wish I was there.
It was so interesting.
So relevant to the community.
Yes, correct. That's true.
So it was really good. Yeah. So every year, every event, there's always new topics, and we try to pick ones that the speakers want to speak on, but also something that is relevant to what's happening currently in the society.
And also, I think the participants that we had in our first event, there were nurses, and a lot of our nurses right now are new grad nurses. So we want to make sure that what we're speaking on and the topics that we're choosing is something that's easily understood too, that's still applicable for a new grad nurse and also for advanced practice nurses.
That's very good. Well, at PNANB, we do have a lot of educators on board, and they are, basically teaching at the colleges. So you can even involve students
Yay!
Yay! Yeah, our president is Flora Saison. She is a professor at CSN.
Nice.
Some of our people teach at Nevada State. So, yeah, there you go. Okay, we'll do. We'll have to collaborate then.
Yes.
Okay, great. Well, thank you very much. And so what is your message to the community regarding cardiovascular disease?
I mean, on my end, for our community, number one, it's we can do education for so long, but it's about applying what we learn and what's being taught to our daily lives. Identifying your boundaries and your challenges too is something that's important to share with your care providers so that we can start bridging that. And I think for our nurses is nursing never ends. The learning continues, and as long as we're interested and we're passionate with what we're doing, there's a lot of opportunities. And if it's cardiovascular that you're interested in, this is one of the organizations that's out there for you that you can join.
Yeah.
Very good. Thanks for that, Florian. And okay, let's hear from you, Kay.
So,
your message to the community and the healthcare providers.
I think my message would be that we are seeing a shift in healthcare where we are passionate about what we want is and what we know is the best for an individual, but we are being more understanding that you're not perfect. No one is perfect. And that we can help you if you let us help you. And I think we just have to be open on both sides to how we can accommodate the changes that we're seeing every day. And I think this is a great opportunity to learn the healthcare side of it, but also we can bridge, that understanding that you don't have to be on a strict diet. You can have the salt.
Yeah.
You can have, can go ahead, have the salt, have the beer, but maybe just bring it down a little.
Yeah,
Something's gotta give
somewhere. But, it's okay. Not everyone's perfect, and that's perfectly fine.
Okay. And your message to the healthcare workers, healthcare providers?
Give yourself grace, but also share that grace with your patients.
Very good. Very good. Wow, that's awesome. I'm so excited about this, the Preventative Cardiovascular Association. So thank you very much, ladies, for coming. On behalf of the FilipiNARS, the PNANV, and PHLV Radio, I'd like to thank you for coming to our program today to talk about your wonderful association. This is another nursing association that helps the public and the healthcare professionals in tackling cardiovascular disease. And as you're telling me, not only cardiovascular disease, but other diseases as well. And I am extremely proud that the leadership is composed of Filipino American members of the association. So thank you very much.
Thank you so much for having us.
Of course. And so if anyone wants to join your association, can you repeat that again? How would they go about it?
Just go to the PCNA.net website and then look for Southern Nevada chapter.
Okay, so PCNA, Preventative Cardiovascular Nurses Association, for all of you. Okay. So thank you again. And to our listeners, we leave you with this. Nursing associations like the PCNA are committed to guide the public in preventing and managing diseases by their activities. These nursing associations are also committed to support nurses who may successfully rise to the challenge of managing diseases and to help them develop professionally. And so please support them and look for them and join them and learn from them. Thank you very much for joining us today. We appreciate you. Thank you for giving us the privilege of your time. Until next time, this is Doris Bauer, your FilipiNARS host, signing off for now.
The Philippine Nurses Association of Nevada has just brought you FilipiNARS, news and features about the Filipino American nursing community and beyond. Friday.